We've all heard birds tweeting outside, the chirping, the tweeting, the sound of birds having a great time. Did you know they call me the songbird of this generation? Oh yeah, I really am. But do you know what kind of bird is being sung out there? Do you know the sound of a robin? Is it a blue jay? Is it some other crazy bird? Maybe it's a crow or a pigeon. Oh no! Alright, now I know you're wondering, alright, Dr. Islam, what the heck is going on? Are you high? Why are you talking about birds singing when there is a topic on the GI tract? Well, just like when we hear a song, we don't know what kind of bird it is. Just like in your gut, you see how I tied it in there? There is a condition that can mimic all other sorts of diseases, whether it's chest pain, heartburn, difficulty swallowing, or just pain right here. That is called a hiatal hernia. Dun, 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 dun. The great medical mimicker that's out there. Sometimes it's so hard to know if the hiatal hernia is a cause of your symptoms or just maybe something that's there. Howdy y'all, Dr. Samir here, aka your poop guru, trying to keep you happy and healthy from the top all the way down to your bottom so you can live your best life. In today's video, we're going to talk about hiatal hernias. What are they? How do they form? And what symptoms you need to keep an eye out for if you may be having hernia issues. And the good news is, if you have a hiatal hernia, there is a very effective, minimally invasive surgical procedure that can fix that hernia and maybe get your symptoms back on track. Guys, let's talk about truth. I'm gonna tell you about a patient of mine named Char. Now, Char had heartburn for pretty much her whole life, 30 plus years. She was suffering from heartburn, regurgitation. She tried dietary options and it worked out just a little bit. She tried to adjust her lifestyle, some improvement. And so we put her on acid reducing medications. And for the longest time, she felt great and her heartburn symptoms got better. But over the course of the next 3 to 5 years before I saw her, she started to notice, hey, I'm having a lot more problems with my heartburn. I am having regurgitation of food. When I bend over, food is coming up. I'm also having some pain right here and also some difficulty swallowing. So she was wondering what the heck is going on. And she came to see me to hopefully evaluate what is going on. Did a physical exam, did some imaging, and we did an upper endoscopy or an EGD. And what we found was that she had a very large hiatal hernia. A large part of her stomach was going above where it should be, and this was the cause of her symptoms. Now, we tried to optimize her medications, we tried to change her diet even more, but despite doing all of that, she is still having her issues. And so we did a workup, we sent her to a surgeon, got her hernia fixed, and lo and behold, she felt so much better. Her symptoms went away. We're able to wean her off her medications, and she's doing great and living happily ever after. So what exactly is a hiatal hernia? So normally you have this organ or this sheath called the diaphragm, which separates your stomach from your esophagus. Above is where your esophagus is, and below that is where your stomach is. And there is a small hole that's right there, which goes through your esophagus into your stomach, called a hiatus. And this helps prevent your stomach from going above where it should be and keeps your esophagus above the diaphragm. Now, for some people, that hiatus, that hole, can become larger and larger. And if it becomes too big, part of the stomach goes above where it should be, above the diaphragm, to create what's called a hiatal hernia. Now, a hiatal hernia is very different from other hernias like your umbilical hernia or a ventral hernia, which you can see. Typically, you cannot see a hiatal hernia. It is on the inside. You can't see it, but it can let you know it's there based on the symptoms it might cause. And like I mentioned before, hiatal hernias can cause such a wide array of symptoms. It is called the great medical mimicker because it can cause all sorts of symptoms and it may not cause any symptoms whatsoever. And the difficult thing about a hiatal hernia is to know, A, is it the cause of your symptoms? B, would fixing the hernia fix your symptoms? Or C, could your symptoms be due to something else and that hernia just be kind of a red herring of what is going on? So what are some of the common symptoms of a hiatal hernia? Number one is difficulty swallowing. If things are getting stuck, it could be that the hernia is trapping food where it shouldn't be, making it more slowly to go down your esophagus, make it more difficult to eat. Number two is chest pain right here. Now keep in mind, if you're ever having chest pain, you need to see a cardiologist. Your heart needs to be worked up. Your heart is probably the most important organ that's out there. I can fix your esophagus. I cannot fix your heart that needs to be checked out. But assuming that your heart's doing okay, a hiatal hernia can sometimes cause chest pain. Number 3, heartburn or acid reflux. When you have a large hiatal hernia, that hernia traps acid above where it should be, and that hernia sometimes can cause the lower esophageal sphincter, which is that door that normally is closed when you're not eating to prevent acid from going up into your esophagus. That hernia can make that door become wide open, so acid rushes up into the esophagus to cause that heartburn and burning inside the middle of your chest. Number 4 is abdominal pain. Absolutely, abdominal pain right here in the middle of your chest. Ooh, that kind of hurt a little bit. That can also be due to a hiatal hernia. And I want to thank you for watching. If you haven't already, don't forget to smash that like button, comment down below. Number 5, shortness of breath. Can you believe that if you have a large enough hernia, it can collapse your lungs and make it more difficult for you to breathe? I've had plenty of patients that had half of their stomach up above the chest cavity, compressing on their lungs, causing shortness of breath to occur. And lastly, vomiting. If you have a lot of nausea or vomiting of food or water, you just don't feel very good, you have that those issues, that can also be due to a hiatal hernia. Now, if you experience any of these symptoms, make sure you talk to one of us to see if we need to see if you have a hernia, but also more importantly, is that hernia the possible cause of your issues? Because like I tell all my patients, just because you have a hiatal hernia, it does not mean it needs to be fixed, and not all symptoms can be due to a hiatal hernia. You need a very thorough and careful investigation to see exactly what's going on, because there's no point in you undergoing a surgery that's not going to help you, or it's not going to fix the issues that you're having. But if you're having these issues, come see one of us. We can see what's going on and hopefully get you taken care of. What I want you to do this week, my call to action to you, if you have these symptoms, pick up that phone and call your nearest doctor to find out why. Why are you having shortness of breath? Why are you having difficulty swallowing? Why are you having really bad heartburn? You will hopefully come away with a diagnosis and a plan of action to get you taken care of. And if it's a hernia, you can come see me, or we can do our work to find out exactly what is going on. So I want to thank you for watching. My question today for you: have you had a hiatal hernia? Have you had symptoms like this? Did getting your hernia fixed make you feel better? Comment down below. I would love to hear what you guys have to say. I want to thank you for watching. Don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to my newsletter, where you can get great tips and tricks like you're learning in this video. Guys, I want to thank you for watching. Don't forget, let's talk about poop. Thanks, guys.